Hi everyone, very good morning and welcome to this new series that we are starting for this month, that is September. And you need to look out for two things on the YouTube channel. So first, in the morning at 8 o'clock, to give you that morning boost, we would be discussing a quick 5 to 6 MCQs to boost up your morning and get you going for the day. And right at the end of the day, that is at 10 p.m., we'll be meeting and restarting a series which we had followed when our NEET PG exam was going to be conducted. So now for the other students, I'm restarting this series, and that happens to be IOTT image of the day. So either there'll be a single image or a theme on which I can club 4 or 5 images and give you a common collage for the same, and that is what you need to look out for. So 8 a.m. and 10 p.m. are the timings in the month of September when we'll be meeting on the YouTube channel. So let's begin with today's morning session, that is the quick 5 morning boost. And the very first question that I've got for you here is quite an easy one, so let's quickly go through it. There's a 25-year-old female who presented with a swelling in the front of neck. TSH levels are elevated, so TSH is elevated and the biopsy findings are shown below. What is the possible diagnosis? So, the kind of history that is given is a very short one. I would not even call it a medium length question. It's a short 2 to 3 line question where they've given you a swelling in the front of the neck. Now, a swelling in the front of the neck can be multiple things. It could, number one, give me a thought of a thyroid gland. Number two, I could also think of probably some kind of a lymph node swelling. If it would have been a child, or otherwise I could also have thought of thyroglossal cyst. Now, I need to look further as to what is given. Is the swelling moving with deglutition? Because all of us know that thyroid swellings move with deglutition. However, that kind of a history is not given to me. So I read further, I see TSH levels are elevated. So definitely I'm pointing more towards thyroid, and they are saying if TSH is elevated, I'm kind of assuming that T3 and T4 levels by default would be reduced. So I'm dealing probably with a case of hypothyroidism, decrease in T3, T4 and increase in TSH. And the biopsy that is given to me over here is speaking for itself. It's a classical case of Hashimoto's thyroiditis. So yes, that is a case of hypothyroidism in which the TSH levels are elevated. But what does this image practically show me? So if you see over here, there's a very characteristic pinkish area and then there's a very characteristic blue area. So when I'm talking about Hashimoto's thyroiditis, all of you know that it is an autoimmune thyroiditis in which there are lots and lots of lymphoid aggregates that are formed. Autoimmune disorders, right? So all of them are very rich in lymphoid aggregates, and that is what you're seeing in those blue areas. All these blue areas, one over here, this one over here, this one over here, all these are lymphoid aggregates. But you say that lymphoid aggregates are supposed to be extremely blue. Why is their center looking a little lighter? If you see, the periphery is very blue, the center is light. Again over here, see, the periphery of the aggregate is very blue, and then there's a lighter center. So that lighter center, the center of a lymph node or a lymphoid aggregate, germinal center is formed. So it's almost like a lymph node is forming inside a thyroid gland. It gives you the feel of a lymph node, right? So lymphoid aggregates with germinal centers, and all these pink areas are the thyroid follicles. Let me show you another image, probably a variation. Again, another image over here. So here you see these round follicles. Why do I call them follicles? Because these round follicles are filled with the pinkish color colloid, right? So this is the thyroid, and apart from that I see these bluish areas, and these are the lymphoid aggregates that I'm talking about. So yes, this is a case of Hashimoto's thyroiditis, but one feature of Hashimoto's is missing out here, and that is that thyroid follicular cells can become very big and pink in color. What are those cells known as? Those are known as the Hurdle cells. So what are Hurdle cells? They're actually said to be one of the hallmark features of Hashimoto's. I'm just saying they're hallmark of Hashimoto's. I am not saying that they are specific for Hashimoto's thyroiditis, because they can be seen in many other conditions. They can even be seen in cancers, neoplasms. They can be seen in inflammatory or autoimmune conditions. So it's not specific to anything. So Hurdle cells are very, very pink. If you highlight all of these cells over here, they have become very big and pink in color. So what has given them that very dense pink color? That is, they are very rich in mitochondria. They are highly rich in the organelle mitochondria, and that is, if you remember guys, a few days back under IOTD, I had given all of you a homework, and I had asked you that what are the other names of a Hurdle cell. So today we can continue from the same. Hurdle cell is also known as an oncocytic cell. I'll give you the meaning of each. It is also known as an oxyphil cell, and it is also known as by another scientist, that is Ashkenazi cells. Now what does all this mean? So first and foremost, Hurdle and Ashkenazi are the ones who identified it collectively. So these are names of scientists. What do you mean by oncocytic cell? Oncocytic or oxyphil, these are the names that are given to any cell in the body which will be extremely rich in mitochondria. So let me give you another example. If I say I'm talking about liver cell, I'm talking about hepatocyte. Is a hepatocyte very rich in mitochondria? Yes, it is extremely rich in mitochondria. So is hepatocyte also referred to as an oncocyte? It is. Any cell which is extremely rich in mitochondria is referred to as an oncocyte, and especially for the FMG students, this is a previous year question. The meaning of the word oncocyte. Now I'm saying Hurdle cells are very rich in mitochondria. So yet again, yes, that is also known as an oncocyte. So yes, that finishes off Hashimoto's. To sum it up, number one, you will see lymphoid aggregates along with thyroid follicular cells. Those thyroid follicular cells are changing into Hurdle cells, which are the hallmark feature. Patient presents with hypothyroidism, which was clearly mentioned over here, and this was the image. So this is a case of Hashimoto's thyroiditis. Moving on to question number 2 of the day, which is a very, very famous FMG special. I think every alternate session has this question, so everyone has to watch out for this. You have to find me the incorrect statement about the pigment which is shown above. So before I get on to all of this, I just want all of you to visualize the pigment. So if you look very carefully, I'm not zooming in, primarily because in the exam you are not allowed to zoom in. I will show you a zoomed in picture, but first try to pick it up at this power. So you say that, okay, I'm seeing a blue color nucleus. This must be the nucleus of the cell. And around the nucleus, you can see some brown color materials. So what is my, basic that I picked up over here? That the color of the pigment is brown, and the location of this pigment is only around the nucleus. It is perinuclear. I think even by this much I know the only pigment which classically is perinuclear in location is lipofuscin. That's a pigment. That is my tentative diagnosis. Let me start reading the statements given to me. First and foremost, it is defined as yellow brown in color. I think I agree. Yes, this is a brown color pigment, and I'll mark this as a true statement. It is formed due to lipid peroxidation. Exactly. So what is lipofuscin? Lipofuscin is a lipo. Word lipo tells you that it is formed because of lipid peroxidation. It is a true statement. Is it positive for oil red O? Again, the word lipo tells you that it has that lipidaceous component. Yes, this is positive for oil red O. Commonly seen in infants. Now guys, that is the answer, because this is the wrong statement. It is not an infantile or a childhood pigment. It is always seen in elderly, and I think the FMG students at least know that whenever a question has to come on lipofuscin, the age for some reason is stuck on 83. Ever since this question started coming in your exam, the age has always been a 83 years old, right? Even in the December 2020, it came as 83-year-old man. So having said that, this was the wrong statement, and a quick review. Now you can zoom into the picture and see everyone. So this happened to be the nucleus, and the brown pigment is just around the nucleus. It is yellow brown and perinuclear. What are the other names given to lipofuscin? So it basically is an old age pigment. You call it senile atrophy. You see it more with old age. Why do you see it more with old age? Because with old age you have more wear and tear. With old age you have more free radical injury, and obviously it's brown in color, so you call it brown atrophy. These are the different names. It's the wear and tear pigment, it's old age pigment, brown color pigment, free radical injury. So these are the other names that have been given to it. Now coming to the last question of lipofuscin, as to what are the special stains that you need to know. So first, it contains the word lipo, so you will remember that it is also oil red O positive. Second, it contains, the next word starts with, so lipo tells you oil red O, lipid related. F tells you fast. So what is that stain when I say something is acid fast? Fast, I think you will say Zn stain. So yes, the next stain that it is positive for is Zn stain. So remember, lipo for oil red O and fast Zn stain. These are the two stains that you have to know. Let's move on and now go on to question number 3. A very easy one, but this is the talk of the town, so you have to know this question. In a patient, corneal scrapings revealed narrow-angled aseptate hyphae. This is the information given to me. Narrow-angled. When I say narrow-angled, I'll try to draw it out. So if these are the fungal hyphae that I'm trying to draw out, I say they're narrow-angled branching, means there's an acute angle branching that I'm dealing with, acute angle branching. And second that they've written is that it is septate hyphae, so I'll draw septate also over here. That's the classical description that we have for aspergillus. In fact, guys, the way you write aspergillus tells you a lot about it. See, how do we write aspergillus? This is the spelling that we have for aspergillus. So, well, A stands for acute angle branching, and SP stands for septate. So I think now you'll never forget. Please remember, A for acute angle branching and SP for septate. That is aspergillus. So have a look at this image. If I label this as image number 1 and this as image number 2, which of these would you want to call as aspergillosis or aspergillus? So remember, you will say that for aspergillus, I have to have acute angle branching, A for acute angle branching, and yes, I can see acute angle branching here. Number 2, I have to see septate, so yes, I can see these transverse lines over here. I can very well see the septate. So number 2 image is aspergillus. Then what is this number 1 image? Let's describe it first. Do you see any septate, or is it totally clean and empty? There's no line inside it, so you say no septate. This is an aseptate hyphae. Number 2, if you notice the branching, it's directly at right angle. There is perpendicular branching that is occurring. So it's the complete opposite. Aspergillus was acute, this is perpendicular. Aspergillus was septate, this is aseptate. So this is a case of mucormycosis, the talk of the town for a month and a half back. This was the hero at that time, and I hope it never comes back again. So mucormycosis. So M and R, please remember, you also define it like a ribbon. You also call it ribbon-like hyphae because they don't have any lines between them. They're all ribbon-like hyphae. And if you ask, just try to observe which is thicker. Mucor is thicker or aspergillus is thicker. So you will remember mucor is mota. Okay, that is how we learn. Mucor is mota or thicker. So remember the thicker one is mucor. So M for mucor, R for ribbon-like. And you know the mnemonics for aspergillus already. So I hope you've identified this, with which question number 3 is also over. Let's move on to question number 4. So today I've got a complete mix of path and micro, and pretty much that is how it is going to be on all the days, so that you don't know anything from which end is the question going to come. I think that's an actual morning boost which will help you wake up and get going for the day. So which of the following is incorrect about Giardia lamblia? Incorrect statement. So first and foremost, let's start reading. Malabsorption is seen. Yes, let me tell you, Giardia lamblia is an intestinal organism. So it is going to cause, go and inhabit itself in the intestine. Yes, it is going to cause diarrhea. So diarrhea is a common presenting complaint. Can malabsorption be seen? Yes, because please remember, Giardia can cause abnormality in the villi. In the finger-like villi of the intestine, it can cause abnormalities and absorption get hampered. So very well, it can cause malabsorption. These are true statements. I'm searching for the wrong one. Trophozoite is binucleate, cyst is binucleate. So my general rule usually says that trophozoite and cyst don't have equal number of nucleus. There's only one organism where the trophozoite is also binucleate and the cyst is also binucleate, and that is your homework for the day. So usually when we talk about the number of the nuclei, the cyst always has more number of nuclei than the trophozoite. So definitely one of these statements is wrong. Trophozoite अगर binucleate है, which is right. The cyst is not binucleate for Giardia lamblia. I'm going to show you pictures. Cyst does not have two nuclei. Cyst is going to have four nuclei. It's quadrinucleated. However, having said that, your homework for the day is which is the organism, the only organism where the trophozoite and the cyst both have two nuclei only. Both have equal number of nuclei. That is what you have to type out and tell me in the comments below. And I'll be watching out for your answers and giving you the right answer as well. Okay, having said that, so now I must have a look at the trophozoite. This is the trophozoite of Giardia lamblia. And number two, I must have a look at the cyst of Giardia lamblia. So I'll divide this section into two parts like this. So if I see the trophozoite, obviously this is the antero-posterior view and this second one is the lateral view. So how do you think is the shape looking like? The antero-posterior view can look like a pear-shaped organism. Some people like to call it a tennis racket appearance. So many different names as per your imagination can be given to it. A pear or a tennis racket. More than the shape, what is important is how many nuclei do you see? You know, it looks like this. They always define it as an angry man with a beard. That's how you see. So, angry man, obviously, two eyes, right? So, there are going to be two nuclei. How many nuclei? We have total two nuclei. And how many flagella, the beard that is coming out? How many flagella? Remember, four pairs of flagella means a total of eight. Four pairs of flagella is what you have to watch out for. So two nuclei, four pairs of flagella. When you instead of AP view, if you just see it from the side, what is the shape now that it's got? Everything is the same. Nuclei and all is not going to change. Only the laterality has changed. It's a lateral view, and that is what they define as a sickle shape. So yes, it's definitely looking like a sickle. As per imagination, some people like to call it spoon shaped also. So it's entirely up to you. Now let's move on to the cyst. I don't see flagella coming out, and now how many nuclei can I count over here? I can count a total of 4 nuclei. So like I told you, cyst has more nuclei than the trophozoite. So definitely the trophozoite is binucleate. This statement was correct. But cyst is not binucleate. Cyst is quadrinucleate. Well, now that we're studying about Giardia lamblia, why not see Giardia lamblia in a stool sample? So this is a stool sample from the patient, and you can very well see this angry man pear-shaped organism. One nucleus here, second nucleus here, and some thin structures coming out, which are the flagella. So this happens to be the trophozoite. And then you see this round shape, one, two, three, four nuclei. This happens to be the cyst form. Let me show you. These were wet mounts, no stains. I've not used any stain. It's complete wet mount, transparent. If I use a pap stain, for example, now can you see the organisms? Perfectly looking like those angry men, where you can see those two eyes and you can see the beard or the flagellae coming out. This becomes the AP view, the antero-posterior view. Whereas if I just twist it and I see the laterality, I can also see that sickle shaped, right? And now if I correlate this with pathology, how do you see Giardia lamblia on an intestinal biopsy? See, whatever I was seeing up till now was stool samples, diarrhea samples that were given to me. Now I'm going in the intestine. And now I'm saying, how do I see intestine biopsy? How do I see Giardia on an intestinal biopsy? And first and foremost, let me try to identify the intestine. So what is this finger-like projection? This finger-like projection becomes the villi. And what are these empty looking cells over here? These empty looking cells become the goblet cells. That is the characteristic of intestine. All these empty looking cells over here become the goblet cells. So where do you see the organism? The organism is seen not attached to the cells, not inside the cells, no. The organism is seen somewhere out here. So can I say the organism is intraluminal? That's the first identification point of Giardia. The organism is intraluminal. Having said that, if you see that on a biopsy, the scenario is quite changed. You're only seeing those sickle type of very folded kind. So instead of seeing the AP view, you're seeing the folded and the lateral view. You're seeing the sickle kind of organisms that are more predominant, right? So that's the type of or the morphology that you see on a biopsy. These pictures are becoming very important. Having said that, now coming to question number 4 and 5. So if I ask 5, actually fourth is done, coming to question 5, which has two parts. Because it's pretty much the same, so I thought why not include it and club it up. Which organism shows you the jerky or the twitching motility, and which organism shows you the falling leaf motility? So, first and foremost, the falling leaf motility is shown by this angry man, by the Giardia lamblia. But obviously, which of them had the flagella, which will show the motility, the cyst of Giardia lamblia or the trophozoite of Giardia lamblia? So, obviously, you know the trophozoite of Giardia lamblia is going to show you that motility, correct? So, trophozoite, please remember the trophozoite of Giardia lamblia shows you the falling leaf motility. Then, what shows you this jerky or twitching motility? Twitching motility is shown by Trichomonas vaginalis. So why not have a look at Trichomonas vaginalis also? This is how Trichomonas vaginalis looks like. I think the famous question of Trichomonas vaginalis is very evident, that what kind of appearance in gynecology do you see? Some kind of a strawberry appearance. Yes, Trichomonas vaginalis shows you the strawberry cervix or the strawberry vagina. That is right. So how does this Trichomonas organism look like? First and foremost, T for Trichomonas, everything will be with T, okay? T for Trichomonas, T for which kind of motility? It shows you T for twitching or jerky motility, right? And the next T is, does it have trophozoite form, cyst form, or both? So you'll say T for Trichomonas and it has the trophozoite form only. So that is how I said that please remember T, T, T. Remember Trichomonas vaginalis, trophozoite form only, twitching, motility. And how does the trophozoite look like? If I highlight the shape, you'll say again this looks like a pear-shaped organism. So in the very first look, can I confuse this with the same pear shape that I saw of Giardia lamblia? Yes, that was also pear-shaped, and well, this is also pear-shaped. But what's the difference? How many nuclei do you see over here? I see just a single nucleus. And how many flagella do you see over here? So 1, 2, 3, 4. 4 going anteriorly, and then this one which is attached to the membrane going posteriorly. So I see 4 plus 1 flagella. How do I define it? The 4 flagella that I see are going free and they are anterior. One flagella which is going posterior, which is going backwards, is attached to an undulating membrane. That's not free, okay? That's with an undulating membrane. So now I know how is this different from that Giardia lamblia angry man. This has one nucleus and 4 plus 1 flagella. Giardia lamblia trophozoite had 2 nuclei and it had 4 pairs of flagella, means it had total 8 flagella. This has total 5 flagella, 4 going anterior, 1 going posterior. And you can highlight that over here also. See, you see a pear-shaped organism. Here also you see a pear-shaped organism. Which nucleus? How many in number? 1 nucleus. Some of the flagella are going anteriorly and some of the flagella, if I remove this labeling, yes, some of the flagella can be seen going posteriorly. Some go anterior, some go posterior, 4 plus 1. Well, so coming back, the jerky or the twitching motility is with Trichomonas. Falling leaf is by the trophozoite of Giardia lamblia. I think you delineated two very easily, which also brings you to the end of the quick fun. Well guys, that's the morning boost for all of you, and we would be meeting again today at 10 p.m. for the IOTD. So this is at least for this month, you can consider this as a ritual. Morning 8 o'clock we decide on a quick boost, and evening 10 o'clock the IOTD. Well, for all the students who've joined us today itself, I just want you to know that Unacademy also has a plus subscription which gives you access to all the live recorded classes, and it also now gives you access to printed notes. Apart from that, there is also a new feature that has come up on the app, and that is raise a hand feature, where you can raise your hand and actually it becomes like a live class where you can talk to the educator, so audio would also be a possibility from your end. Having said that, these are the offers that are going on the Plus and the Iconic subscription. The Plus subscription gives you access only to Unacademy, whereas the Iconic subscription gives you access to both Unacademy as well as Prep Ladder. Well, thank you so much for joining in. I hope you guys would enjoy this series. Any more feedback, please do put it up in the comments below. And I'm also watching out for the homework that I gave you today, that which is the organism which has same number of nuclei in the trophozoite and the cyst form. So I hope all of you get it right, and I'm pretty sure about it. See you all in the evening at 10 o'clock. Have a great day.